Dr. Funk, you were just alluding to how ultrasound can be a great additional exam. So while you get started, can you talk about why you use ultrasound as an additional exam?
You bet. So no single imaging study is perfect. So we use as many as we can as appropriate for each person. So Robin, having dense breast tissue, is a perfect candidate for ultrasound because on a mammogram with all that density, which looks like white splotchiness, cancer, being a white ball, can often get camouflaged and missed. Ultrasound sees breast as white, but cancer as black or dark. So we're going to ultrasound Robin's breast right now, and what I'm looking for but hoping not to see is something dark and shadowy.
Can I say how nerve-wracking it is? That I understand if women are afraid. Like sometimes, you know, even you think I'm a smart woman, but you know, you're thinking it's scary. It does feel scary, yeah.
Right. Yeah. And we really haven't done the ultrasound yet, so Robin is scared.
Go ahead and get started, Dr. Funk.
All right, so what we're seeing here on the ultrasound, the white line across the top is Robin's skin, and then this streaky thing right here, this beefy pec muscle from all the working out, is overlying ribs. Like here's a rib, and then lung is beneath this. And what we're looking at is the breast tissue between skin and muscle. Two main types of breast tissue. This darker black is squishy fat. The brighter white gray is dense, firm breast tissue, the density we were talking about on mammogram. This brings up a good image here of why women say, I'm not going to do self-breast exam. My breasts are all lumpy and wig me out. This is why. Your skin here, you push through the black fat, right? Your finger is pressing on the breast. Look at this. You press here, and then, not pressing so much. And then you press here, and then you press there. So this lumpiness, this terrain that kind of goes up and down like a mountain range, can be confusing to people. You just want to do your self-breast exams, though, and learn the lay of the land, because this won't change. And if you notice a change, then you come in for an ultrasound. So far, so good, Robin. We're not seeing any masses. Sometimes you'll get a perfect black ball. That's a cyst. That's a fluid-filled, little benign, totally normal. 50% of women have them. We're looking for something that's kind of in between our two shades of gray and white. So it's dark, and it doesn't let the ultrasound beam go through it. So what you would see, kind of like this rib, okay? If this rib didn't have such a sharp border right here.
So that's a rib?
That's a rib.
Okay.
It's under your
But
muscle.
if it feels a little sore, should I be concerned? Do you know what I mean?
While she's pushing?
Yes.
No.
Okay.
You can let her know when you're sore, because then Kat can stop and we can look at see if there's anything in that breast. But basically, we're pushing down pretty hard on that breast.
Yes.
We're kind of pumping into a nerve that's like enough already.
Okay.
And Christy, you know, we talked about in the tape piece you doing a BRCA genetic blood test on Robin, or in someone who's had a first-degree relative with breast cancer under the age of 50 especially. But talk a little bit about it. It's so important for women to know it's not just the BRCA mutation. There are 25, 34 cancer genetic mutations that we can easily test for with saliva or blood. A lot of them then predispose and increase risk for breast cancer. So explain to women when that would be appropriate. And we have to remember also men do get breast cancer as well, so men should be listening too.
Certainly, if there's any male breast cancer in the family, you should be testing for this 25 gene panel. If you, on mom or dad's side, first, second, and third degree generation relatives, have two relatives with breast cancer prior to age 50 or ovarian cancer at any age, you should test. If you yourself have had a triple negative breast cancer, you should test. Basically, if there's just a whole lot of cancer going on in one side of the family, so 3 or more breast, ovarian, uterine, colon, pancreatic, prostate, and melanoma, we like to test. Don't be afraid of the results. I think that's what... Well, let's ask Robin. Why aren't you testing, Robin?
Why am I... You know, you made me feel better about doing that, but certainly right after it happened with my sister, I was so scared. It was just, everything was so overwhelming. It's like, and then you get to a certain age where you realize things can go wrong, or something happens and you realize things can go wrong.
But I think, Robin, what's so important, and I know Christy and I are on the same page with this, is knowledge is power. So a negative result to this genetic testing doesn't mean you're at low risk, because your sister's history is still in your family. But a positive result with a genetic mutation enables us to either do more involved surveillance or, in some cases, risk-reductive surgery. So it really is, with the right counseling, if the right patient. Not every woman with a history of breast cancer needs this type of genetic screening, but it can be life-saving. So I would encourage you and anyone listening not to be afraid of the result, because it's all about, an informed decision.
Well, now I've got a doctor I like, too.
There you go.
I mean, I like the other one, but now I love this one, so.
Well, and there's something to be said for that.